want to introduce Dr. Leonard Zahn, the professor of pediatric medicine at Harvard Medical, whose research focuses on identifying genes that direct stem cells to become cancers or to develop into more specialized blood or organ cells, and developing chemical or genetic suppressors to cure cancers. And he is the lion of the stem cell field. Please welcome, for a lightning talk, Dr. Leonard Zahn.
Awesome, thanks. What I'd like to do is to tell you about stem cells, and there's a lot of information out there about stem cells, but there's also a lot of misinformation. So I thought what we really needed to do is to give you an overview. And I do want to tell you that there's a test at the end of this, so make sure that you pay attention. So I'm a hematologist at Boston Children's Hospital, and I take care of patients who have blood diseases or cancer. And so I focus on blood stem cells particularly, and blood stem cells are able to travel in your bloodstream, but they end up inside your bones, inside the marrow, and that's where your blood cells are actually made. And these stem cells are amazing. They have the ability to renew themselves or to make the entire blood system. And we know that this actually works because I can do a bone marrow transplant on a patient. So if one of you had leukemia, I can treat the leukemia with high-dose chemotherapy, but then you don't have an immune system, so we need to replace the immune system, and I can replace the immune system with your brother or sister's immune system if it's matched. And this is curative and only needs to be done once. So it's really amazing. So basically, blood stem cells are the only stem cell with a quantitative assay. That's the transplant. They're the only stem cell that's used therapeutically besides skin at the moment. We do thousands of bone marrow transplants every year. We do hundreds of gene therapy and gene editing trials, and these use blood stem cells. And when a mutation happens in a stem cell, you can end up getting leukemia. Now, this is a type of adult stem cell. So in other words, in your body you have organs. In the organs you have different stem cell populations that can remake that organ. But in general, the stem cells are particularly targeted to that tissue type or organ. So now what a few of us and some friends have done is to actually make something called an induced pluripotent stem cell. So what this is I could take anybody's blood here, or a skin cell, and reprogram it with 4 genes to make it think it's an embryo. Okay, and then what do we know about embryos? Embryos can make all the tissues of your body. So there at the bottom, I can make this human induced pluripotent stem cell, and this will make every organ of your body. And so what we've been doing on the left there is trying to turn those cells into tissues in a dish. And so we can make them into blood cells, we can make little mini lungs in a dish, livers, and it's really amazing. And in the past, we've been going and making drugs to try to treat a disease in a dish. So if I have a child who has a particular genetic disease, I can make a stem cell line from that patient, and then if they're having trouble making blood or making a heart, we can try to fix that particular problem. But recently, over the past couple of years, we've been doing something that I think is even more interesting. We've been taking these cells, making them into the tissues, and putting in healthy cells into diseased organs and fixing the disease. And this is cell therapy. And the data is unbelievable for this. It's really working right now. And my lab has been trying to do this for blood stem cells, but a number of companies have really done wonderful clinical trials just over the past year. So for instance, Vertex has been able to take these stem cell lines and turn them into little islet cells of the pancreas that produce insulin. And then they shot billions of cells into the liver of patients who have diabetes, and those cells start producing insulin, and they cure the diabetes. And many of those patients are off of their insulin. They've treated 14 patients in a phase 1 trial. There's 3 trials in the world with Parkinson's disease, which is a devastating disease. In Parkinson's, you're missing the dopaminergic neurons, the neurons that make a chemical dopamine. So what people have done, including a company called Blue Rock, is to take those stem cells at the bottom there and turn them into neurons that make dopamine. And then a neurosurgeon will stereotactically go in and inject them directly into the place where you need the dopamine. And the trials are going very, very well. The results are incredibly encouraging. There was one trial from a Swedish trial at Lund University, and he shouldn't have talked to the press, but he talked to the press. And he had 17 years of Parkinson's. He was completely frozen. Now he's skiing and he's swimming. So it's really amazing. Another friend of mine has turned those into something called interneurons. These are the connectors of your nervous system, and he's been able to treat seizure disorders. And so in a temporal lobe epilepsy where you have 50 seizures a year, it's down to 1 seizure a year in a company called Neurona. And so these are really amazing examples, and all of this has happened over the past year and a half. So it's very, very recent, and so I'm very, very excited about these cellular therapies. So as I talked about, blood stem cells are what I work on, and we've been trying to take these cells and turn them into blood stem cells so we don't have to have a perfect match with everybody. We'd be able to actually treat patients with this. And this has been a hard problem, but recently we've made very, very good progress. And one of the things that is very important is that you need nurse cells for the stem cells, and the nurse cells are actually the blood vessels that are inside the marrow, or of a particular type that feed growth factors to these cells. So we've been able to not only manufacture some of the blood cells, but also these specific niche cells, and we're trying to actually grow the stem cells together with the niche cells so they're nursed, and then we would use those in for transplant, just like we do a bone marrow transplant. And so I'm very, very excited about this. Another friend of mine has been able to take, to find out the signature of the blood vessels that surround those insulin-producing cells in the islets. And he and I are working together to try to develop medicines that you could co-transplant the endothelial cells and the blood stem cells or these pancreatic islet cells and just get a shot in the arm. And then you would either make a marrow in the arm or you would cure your diabetes just like you would take your insulin, but just have it in your arm. And so this is going to be a new therapy that I think will be really exciting. So we heard a lot last night about inflammation. And where does the inflammation come from? Well, the inflammation comes from blood stem cells. The blood stem cells, as people age, end up getting mutated. And these become inflammatory. And so you have good stem cells and bad stem cells. And if we could get rid of the bad stem cells, this would help with the aging process. And so in my laboratory, we've recently realized that an immune cell type called macrophages, which are the eaters of the blood system, they mop up things, actually interact with stem cells. What happens is the blood stem cells are contacted by a macrophage. The macrophage looks for a signal on the surface of the stem cell. We've identified this one signal in a paper that we published in Science magazine a couple of years ago. And then about a month ago, we discovered another signal, which is a don't eat me signal. So this is a binary code for how the immune system interacts with your stem cells. And so basically, if there's a eat me signal on the surface, the macrophage will come in. If there's a don't eat me signal there also, it won't eat the macrophage. And if you could get rid of this don't eat me signal, you'd be able to mop up this the bad stem cells. And so what I've developed through this code is I'd like to make antibodies that target this process so that we can teach the macrophages to kill bad stem cells. And even to take those macrophages and kill leukemic cells or pre-leukemic cells. And I think this is going to be an extremely interesting avenue that's very, 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 very good. Okay, so I've had a good 3 weeks. So I've started 4 biotech companies, and I had in this 1 3-week period, one of my companies did a $115 million Series B. And then this company, Scholar Rock, on about 2 Mondays ago, is working on a regulator of muscle, and it's a negative regulator of muscle. And so this cow here is often called the Schwarzenegger cow. It's the Belgian blue. And this cow is mutated in a growth factor called myostatin. That's a negative regulator of muscle. And so my company has made an antibody against myostatin. And we gave it to kids who had spinal muscular atrophy. And on that Monday, we announced positive phase 3 data on this myostatin antibody. And this is a really, really important thing that will help these kids. We had kids who couldn't walk and they could walk. I mean, it was really amazing. And so that was on a Monday. And then on Friday, my third company, Camp4, which is a a company that looks on how to upregulate genes, in particular for people who are missing a copy of a gene. We can increase this number, and that company went public. And I was able to go to ring the bell, which was super exciting. So I've had an amazing week. But I really enjoy how you can take basic science discoveries and then bring them into the clinic and being able to make a difference. So, all right, why was I so excited to come here? So I'd really like to look like this guy. There's so much misinformation. Once a week, I am called by somebody, probably here, I've taken 2 or 3 calls already, being here, on, should I have stem cells? Should I go to Mexico and have stem cells? This is called stem cell tourism. There's so much misinformation out there. And, I'd be happy to talk to you about this, but basically what you can see when you go to a website, and this is the Boston Stem Cell Regenerative Medicine Institute, this was just off the web, so it's not in Mexico or Colombia or something like that. And here are all the different therapies that can be treated with stem cells. These are mesenchymal stem cells, and the data that this works is not great. You have to pay for the therapy yourself. On the other hand, some clinics are okay and some clinics aren't. And so I started a society called the International Society for Stem Cell Research. This is 5,000 stem cell researchers throughout the whole world. We have a website called About Stem Cells, which helps you evaluate whether you should have these types of therapies. But if you have any questions, call me, because I think that there's so many people who've had really terrible therapies. There's one person I know went to Florida for blindness, and then they ended up getting transplanted with both eyes, and their stem cells were infected, and they ended up getting blind from the whole thing. So it's really important to think about this, and it's one of the reasons I was super excited to come here and talk to you. So thank you very much, and happy to take questions.
Right. So we'll have time for one or two very quick questions. Who's got the first one? Raise your hand if you got one. Carl, sorry, I'm getting the mic over to you.
One of the trends in the last decade or so in stem cells research is to find that this injected stem cells often fail to survive and engraft themselves. It's related to the niche, but they often have therapeutic effect even though they don't survive, and it's mediated by the secretions. Mm-hmm. Can you just make some broad overview comments about where you think the field's going in the future in terms of what fraction of the field will continue to be actually injecting whole cells versus this move to, actually injecting the secretions themselves?
So one of the reasons in survival, we think they're missing these endothelial cells. So if the endothelial cells were co-transplanted, the cells would survive more. So I think there's a future still in putting the entire cell population. But we're also trying to find out what are the codes, what are the growth factors that are made, and if you could do individual growth factors, that's a much easier therapy than the cell therapy. Absolutely.
We have another question? Over here.
So in aging field, there is a idea that you can use Yamanaki factors to reprogram cells non-completely, and people call it rejuvenation. What do you think about that?
Yeah, so what we're referring to there is some really interesting information from some friends where if you take, instead of the 4 factors I put in to completely teach the cells to become embryonic in character, you put in 3 factors. And those 3 factors reprogram mice, and then those mice live longer. So there's this rejuvenation therapy, and this is a very, very, many of the companies that have been started are based on rejuvenation. So I think when you're doing it in a mouse, you can overexpress those genes and basically keep them on for a long time. So that works. Trying to figure out how to do that in a human is very, very difficult because you're not going to insert those 3 genes all over your body. You're going to try to figure out some other method. So we need to understand the basic science more before being able to do that.
All right. Thank you, Dr. Zahn.